Hey, how are you today?
I'm just fine. How are you?
What's your name?
Rod.
My name is Omisha. I'm going to be your registered nurse today.
All right.
What brings you in?
I'm getting a physical for work.
Okay, a physical for work. That sounds great. So our physical assessments take about 15 to 20 minutes. Anything that we find out today is going to be confidential. Any questions that you have, you're more than welcome to ask those, okay? So I just want to let you know that I'm going to be washing my hands. We're going to make sure that we are preventing infection, and that's the easiest way to ensure that that keeps me safe, keeps you safe, and our other patients safe. So I just want to let you know that I have gone over your vitals. We did do a vitals assessment. So your temperature is going to be 98.6. That's within normal range. Your oxygen is 98% on room air, so that's normal. Your blood pressure is 120 over 80. That is, can't get any more perfect than that. Also, your respiratory rate is 17. So are you in pain at all today?
No, I'm not.
Okay, great. And just to assess your mood, how would you describe your mood today?
Awesome.
Okay. And then have you been feeling down or anxious or anything like that lately?
No, actually, I feel pretty great.
Okay, wonderful. So I'm just going to assess some things. Can you tell me what your full name is?
Rodney L. Riles.
Okay. And do you know where you are right now?
Yes, I'm at the clinic getting a physical.
Okay, perfect. And do you know what today's date is?
March something.
Okay. Do you know why you're here?
Get a physical.
To get the physical. Okay, great. So I do see that you are alert and oriented ×4. So now I'm just going to assess your skin. If you don't mind, I'm just going to be touching just ever so slightly. Let me take a look. I see you have Dexcom back there. See that the skin on the arms have hair. Also, oh, you got a brand. Are you a part of an organization of some sort?
Q-Sci-Fi.
Oh, okay, perfect. So I'm gonna also be assessing the skin for the appropriate amount. I see that your skin is appropriate for ethnicity. I don't see any pallor, any kind of cyanosis, or any kind of jaundice. I don't observe any kind of rashes or lesions or discolorations on the skin. I'm going to actually also be palpating the skin just to ensure that there's no excessive dryness. I don't feel that. I'm going to assess your skin turgor, which it is non-tinting, so that is great. So the next thing that I'm going to be doing is I'm going to be assessing your scalp. Just taking a look to see that the skin on the scalp is pretty normal. I'm also just going to be feeling the head for symmetry. Feels pretty normal cephalic. Also, do you have any tenderness or any kind of nodules or anything in the head?
Not that I know of.
Okay, perfect. I am assessing that skin. The skin is warm and the temperature is equal bilaterally. Okay, so I am going to be assessing your nails. Can I take a look at your nails? Okay. So nails are rounded, trimmed. Okay, I'm just going to be assessing for cap refill. Going to be doing that bilaterally. All nails seem to be in good shape. And capillary refill is equal on fingers. Also, I'm going to be assessing your skull. So just let me know if you're feeling any kind of discomfort or anything, okay?
Sure.
All right, so as I'm assessing your skull, I'm going to be assessing for the size, shape, and symmetry like we talked about a little bit before. I'm going to be looking for moisture. The hair is kind of a kinky coarse texture. Okay, and hair is evenly distributed. It is clean with no evidence of parasites or any kind of nits. So I'm going to be inspecting the facial skin for uniformity and color, which of course it does appear to be even and appropriate for your ethnicity. No, I don't see any lesions, any discolorations, or any kind of asymmetry noted. So I'm looking at your facial features. Those are symmetric. The eyes are in the upper third, nose in the mid quarter of the face, and then the mouth in the lower third of the face. So I'm not seeing any kind of facial drooping or any kind of abnormal movements were observed. So now I'm just going to be checking your neck. Okay, skin actually does appear to be symmetric with the color of the skin, as well as I'm just going to check your carotid pulses. Okay. and those are equal on both sides. So now I'm going to be assessing your lymph nodes. So I'm going to be assessing your preauricle, which is right here in front of the ear, post-auricular, which is right behind the ear. I'm going to be doing the occipital, which is the back of the head, as well as the tonsillar, which is the top edge of the jawline underneath the tip of the ear. I'm also going to be doing your submandibular, your submental, superficial cervical is just the lower neck, just almost down to the shoulders. Posticular cervical, deep cervical, and your supraclavicular, which is your shoulders. Okay, now I'm gonna assess your eyes, okay? Let me know if you feel any kind of discomfort while we're doing your eyes, okay? So I'm just gonna be inspecting the eyes for any kind of drainage or any kind of lesions. I have a pen light, just double checking to take a look. I'm gonna look on the opposite side. Your eyelashes are evenly distributed, as well as on the upper and the lower lash line. Your eyebrows are present, they're symmetric and coarse in texture and appropriate for the skin tone, and I don't see any kind of scaliness or lesions noted. I'm going to also be inspecting your pupils for size, shape, and symmetry. So I'm just going to come across with the light. Okay. Okay, so your eyes are equal, round, and reactive to light. If I was using an ophthalmoscope, I would just be checking the pupils of your eyes, just the overall health of the pupils of the eyes. So I just want to make sure that the light is able to reflect from the back wall of the eye. So now I'm going to assess your ears. So I'm just going to pull your ears up and back. I'm going to assess on both sides. Okay, and then I'm just checking the elasticity of the auricle, and then just making sure that if there is a little bit of cerumen present, that is just earwax, and that is pretty normal. Also, we're going to be, if I was using an optoscope, that was just basically me looking inside the ear, and I'm going to be looking for any kind of, assess the color and integrity of the tympanic membrane. So it's supposed to be pearly gray, as well as presence of fluid, any kind of redness, or any kind of signs of infection in foreign bodies. Now I'm going to assess your nose. I'm going to take a look. Okay, and the nose is midline on the face, as well as without any kind of deviation or asymmetry. I'm also going to be checking the skin over the nose, which is intact, as without any kind of lesions, redness, or any kind of swelling. So I'm going to actually be palpating your frontal and maxillary sinuses. So when I press here, does it feel tender?
Mm-mm.
When I press here, does it feel tender?
No.
Okay. Okay, great. So the nose is midline, the skin is intact, frontal and maxillary sinuses are non-tender, and the nares are patent bilaterally. So now I'm going to be looking in your mouth. Please let me know if you have any questions. Okay, so I'm going to be taking a look. Can you say ah for me? Okay, so I'm just going to be assessing the buccal, mucosal. Also taking a look at your hard palate as well as the soft palate. Can I have you to lift up your tongue? So I am seeing that you do have veins present. Can I have you to stick your tongue out for me? Okay, and then also I need to see your teeth. Okay. Okay, so I am seeing that the teeth are white. They are intact. Tonsils are present. So let me take a look at your tonsils if you don't mind. Do you have tonsils? Okay, I do see it. All right, so I'm also going to take a look at your eugloba. I'm just double checking to make sure that it is midline. Those tonsils are appropriate in color. There's no swelling, no kind of exudate. Also, when I looked at your tongue, I was just looking at the surface of the tongue to make sure that it's pink. You do have a little rogate there, so that is pretty normal. Also, I'm going to be assessing your chest and your lungs, okay? So, let me know if you feel any kind of discomfort. So, first I'm going to be inspecting the chest. You got your shirt tucked in, huh? Okay, so I'm just taking a look first. I'm just going to be assessing the chest just to make sure that everything looks okay. So the skin is intact. It's appropriate in color. Color is uniform without any kind of lesions. I'm going to actually palpate the chest. And basically what I'm doing while I'm palpating the chest, I'm just checking for any kind of tenderness or any kind of lumps, okay? Does it feel tender at all? Any kind of tenderness?
No.
Okay, so I'm gonna have you to actually turn and face the away from the camera. I just need to be able to see. Let me take a look at your back. Okay, so the skin on the back is uniform. You do have some very small, like little moles and things on the back, but otherwise the back looks great. Not seeing any kind of rashes or lesions or discoloration, okay? I'm also going to be palpating for the tactical Freeman, so I'm going to have you to say the word 99 for me.
99.
Okay, 99 again.
99.
Okay. One more time.
99.
Okay, and one more time.
99.
Okay, so what I'm going to be doing is I'm going to have you take a deep breath in for me. Okay, then you can let it out. Okay, so basically what I'm checking to see is if your expansion of your back is symmetric bilaterally, which I do see that it is. Also, I'm going to be assessing the anterior chest turgor. So I'm just going to be feeling right underneath the clavicle. And I'm just checking to see that you do have no tenting there. Perfect. So I'm going to actually also auscultate. So I'm going to be listening to your posterior lung field. So I'm going to have you to take a deep breath in. But I want you to be a little bit exaggerated with it, okay? Okay. You can let it out. Okay. Okay. Do it again. Out. Okay. Out. And if you could just breathe normally for me, that would be great. Just take a deep breath in. Okay. Deep breath in. Perfect. Deep breath in. 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 All right, so it does appear that the vascular breath sounds in the peripheral lung fails. Your inspiration is greater than expiration. So now I'm going to have you to turn just to the side for me, if you don't mind. I'm going to actually be listening to your anterior chest, or lateral chest, anterior lateral chest. Now I'm going to have you to elevate your arm for me. Perfect. Okay, so I'm going to have you take a deep breath in and let it out. Deep breath in. 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 Let it out. And then one more. Deep breath in. Okay, perfect. So the lung sounds are pretty clear. I'm not hearing anything. It sounds normal bilaterally. Okay, so now I'm going to be auscultating the anterior lung fields in 10 areas, okay? So take a deep breath in for me. Okay, so those long sounds are clear bilaterally. I'm not hearing any kind of wheezes, any kind of crackles, or any kind of ronchi. So what I'm also needing to do is do a cardiovascular assessment. So I actually just want to be able to assess. You can turn toward me if you don't mind. So I want to be able to do a cardiovascular assessment, and then I'm just going to name those points out. Okay.
Okay.
All right. Perfect. Okay, so this is going to be your aortic. This is going to be pulmonary. This is going to be Erb's point. This is going to be tricuspid, and then your mitral area, okay? I did palpate those areas. I was able to hear that everything sounds clear. Also, I'm going to turn and I'm going to listen to it with the bell. So if you could just breathe normally for me. Okay. So I'm going to actually need to have you to lay down for me if you don't mind.
Over here?
Yeah, just so I can inspect your abdominal area. You can lay
on my back?
across. Yes, lay on your back, please. So what I'm actually needing to be able to do at this point is to be able to listen to your bowel sounds on your belly. That's going to actually help me to be able to, I'm just going to take a look, which I looked earlier, so I saw that there was a little bit of hair present, as well as the skin is normal for your ethnicity. I didn't see any pallor, any kind of cyanosis or anything like that. So when we're listening to bowel sounds, that's going to be the very first thing that I'm going to do, okay? So I'm going to listen first, then I'm going to palpate, just lightly palpate, and then I will percuss, okay? So basically, I did see that the abdomen is a little rounded, as well as the umbilicus is midline, and there's no visible peristalsis. Okay, so I'm going to actually be starting in the lower right quadrant. Your appendix is located there, and I'm just going to need you to be quiet for me for just a little bit, just because I need to be able to hear the bowel sounds. Okay, so in the lower left quadrant, your sigmoid colon is there. Okay, I'm going to go to that left upper quadrant, with your stomach and your spleen is located there. And bowel sounds are hypoactive. And then in the right upper quadrant, I'm going to be your spleen and your gallbladder are there. I'm sorry, your liver and your gallbladder are there. Okay, and I'm going to have you to sit up for me. Perfect. Oh, well, actually, you can stay laying down, because I'm just going to feel, okay? I just want to make sure that I'm just going to lightly perform little palpation in all 4 areas. So when I push, does that hurt?
No.
Does it hurt at all?
No.
What about there?
No.
Any tenderness? Any tenderness there? Well, you are gritting a little bit. Am I just giving you a little tickle? Okay. All right. Just wanted to double check and make sure. So I just wanted to make sure that all of the vowel sounds are present. Everything looks good. As well as now, I'm going to have you to sit up for me. And what I'm going to do now is I am going to inspect your... I'm going to have you to have a seat on this stool for me if you don't mind. So what I'm doing now is I'm going to assess your arms, your legs. I'm just checking for vascularity. I'm making sure that you don't have any kind of edema or anything. Do you mind holding your arms out for me? Does it hurt at all? Okay, do you have pretty good range of motion in those extremities, upper extremities?
Yes.
Okay, so I'm going to be actually listening to, I'm just going to be feeling your radial and brachial pulse. Those do feel equal on this arm, as well as your pulse is +2. So normal. So let me check on this side if you don't mind. Okay, then I'm going to be assessing your apical pulse for a full minute. Okay, and those are actually, your pulse rate is 76 beats per minute. If you don't mind me taking a look at your legs, I may have you to sit up on the very end of the table for me, just so I can take a look at those legs. Okay, so as I'm taking a look at your legs, I'm going to be assessing your pulses on both legs. So this is going to be your posterior. Okay. Then I'm just going to be checking for any kind of edema. Okay. I'm not noticing any kind of edema. I do see you have a small scar on your leg there. Are you experiencing any kind of joint pain or anything like that?
Just a little.
Just a little bit. Okay. And then I'm just gonna pull your socks down just a little bit. Okay. Assessing your pulses there. Pedal pulses. Okay, and then I'm gonna be assessing your tibial pulse. And if you don't mind me just taking a look at your feet, just going to be assessing for cap refill. Okay, it's less than 3. Less than 3 seconds. Okay. You have any questions about anything that we've done today?
No.
All right. Well, thank you so much for coming in to visit with us. And we hope that we'll have those results for you soon, okay?
Thank you.
All right. Thank you.